Good afternoon, Chair Moran, Commissioners, Mr. Lewis. For the record, my name is Chuck Henry, Director of Sarasota County Health and Human Services. And as you're aware, I'm here this morning just to provide an update on our local COVID-19 public health response. Most of you are fully aware that the first case in Florida was identified as a Manatee County resident who was being treated at Doctors Hospital right here in Sarasota County back in late February. Since that time, things have moved pretty rapidly, and that initial event served really to help focus our public health efforts on what was needed for our community and get the ball rolling on a number of preparedness and prevention actions before we even had our first case in a Sarasota County resident. Just to bring you up to speed on where we're at today with the numbers, we currently have 180 COVID-19 cases identified in Sarasota County. Those are fresh numbers from late this morning. 160 of those are considered Sarasota County residents, 13 are non-residents. When we look at that, the average age for COVID cases in our community here in Sarasota is 62. The age range for those cases is from infant all the way to 99. So you'll see in the FloridaHealth.gov's dashboard, it says 0 to 99. So it is affecting and impacting all ages in our community. 63 of these cases have been hospitalized, and we have 7 reported deaths as of this morning's report. 44% of those cases are male, 56% are female, so it's almost an equal split. Some of the public health actions that I just want to highlight this morning, and there are many others, but there are just a few to highlight. One is this huge undertaking to implement a comprehensive case identification and contact tracing program. And just to say a few words about that, that's for these 180 cases now identified, it's reaching out to every one of those cases and trying to interview the individual if they're available for interview, or those closest to them to understand where that person has been for the probably 16 days prior to the onset of illness, so that we can determine who they may have been in contact with and who might be at risk for developing the virus. Then we reach out to all of those people and talk to them about self-quarantine. If they're ill, we get them tested. And so that process is pretty important in slowing down the spread of disease in our community. But it becomes pretty labor intensive for our epidemiology staff as these numbers grow and they continue to work out in the community. We also established a COVID-19 information line for our citizens, specific for those that have questions about their illness or whether they may have been exposed or not, or if they need information about testing. And so that's operating on a daily basis at the health department, and we've received an average of 200 calls a day for individuals either wanting to have information on testing or having questions about the illness itself. We're able to partner with Sarasota Memorial Hospital and Sarasota County government to provide a local drive-through testing site. Today, it's already wrapped up now. It runs from 8 a.m. to noon just about every day. We do pause once in a while. Today was their 10th day in operation, and things have been pretty smooth from the beginning there. We started out with a goal of trying to do 50 samples a day in that period, and we're now averaging 75 to 80 samples a day. The reason we're sticking with a 4-hour period is we're trying to preserve our personal protective equipment, the PPE that's in such short supply across the community, and using the drive-through method that we have. The only PPE that's really worn is by the nurses that are actually doing the sampling, and we've set up a process whereby the N95 mask, which is actually that hospital-grade respirator that's necessary when you're dealing with potentially infected individuals, can be worn for that 4-hour period using certain procedures. Of course, they're changing out their gloves and other things to protect the patients in between, but it helps preserve our equipment, but we really can't go beyond 4 hours without having to move into another set of masks. So that seems to be working well for us. We also established a elder care response team. Early on, even before our first case in Sarasota, we had nurses out visiting all of our elder care facilities to make sure they were aware of the CDC guidance at the time and they were implementing all of the policies that were recommended, especially around infection control and isolation. Since that time, we've
If you can keep your mic up.
Sorry. Since that time, we've continued with those EPI teams more in a response mode. So whenever there's an issue identified at one of our elder care facilities, we send that team out. We contact them by phone, and if necessary, send the team out immediately to just help review for them the situation they're in, how many ill patients do they have enough PPE to take care of those individuals, are they set up to isolate that individual, do they need help with testing? So we go through all that pretty rapidly with our teams. The teams also respond jointly with Agency for Healthcare Administration as things get reported up through their side, and they are the regulatory agency for our elder care facilities. So we've done many joint inspections with them, but many others independently. With significant support from Sarasota County Emergency Management at the EOC, our health and medical desk is set up now with a team that actually calls all of our elder care facilities every day, asking them a series of questions, whether they have anybody that's ill. If they are ill, we ask questions about that. And we always end with asking about their unmet needs, especially around personal protective equipment, so that we have that daily touch with those, because they do protect our most vulnerable population. And so we're really trying to be careful there. We also provide public health guidance to our EOC operations. And we have benefited, our public health effort has benefited from the EOC's ability to create and monitor dashboards that we can monitor what's going on, to conduct advanced planning, and to help distribute much needed equipment out to our community, especially the PPE as it comes in. So it really is a joint effort that seems to be working really well. Additional joint EOC work that the health department has participated in has been helping to develop housing plans, both for healthcare workers, first responders, and for homeless individuals that may not have a safe place to isolate or quarantine, depending on the situation. And those plans are out there and actively being exercised. We have environmental health teams that are out working actively this week with our social service agencies, trying to encourage, not discourage them from providing service to our homeless population, but encourage them to do it in a way that allows for social distancing, because we see that as a continuing concern. Finally, we were able to convene a meeting with all four of our key hospitals here in Sarasota County. We brought together their executive staffs and planning staffs, mostly through a virtual meeting, although we had one member present at a physical meeting. Everyone else called in, again, trying to stay safe. At that meeting, we were able to, each hospital shared their surge plan and what was going on within their facility, what their concerns were. We gathered that information. It was a great conversation. From that, we are putting together a county-wide plan that helps us at the EOC level better understand where their trigger points are and when things change that we might be able to help out with. So that's constantly being developed as more information is out there, but a very important part of the work we're doing right now. That said, we have obviously much more work to do. Most of the models that are out there predict that our peak hospitalization day will be around April 21st. Last week it was May 3rd, and I just point that out because those models, like our hurricane models, change as data is updated, so we have to watch those on a regular basis. The models have Florida overall looking fairly well this morning, but again, that could change tomorrow with more data. So it's really important that we keep an eye on what's going on in our hospitals, what their needs are, and what's going on in our elder care facilities. The unfortunate reality of this virus is that it's always 10 to 14 days ahead of us, so we're always trying to catch up. And by that I mean the actions that we take today as individuals and as a community will impact how much illness we have 10 to 14 days from now. And that's a really important thing to recognize, because all of the things that we're encouraging people to do that began with hand washing and trying not to touch your face, staying home if you're sick, and now has evolved into all of the social distancing, including the stay-at-home directive from our governor and encouraging people to not gather in large groups at all is really important in slowing down the spread of this disease. That's not only important for all of us individually for our personal health, but it's important so that we don't overwhelm our healthcare system as we reach the peak of this epidemic. We want to ensure that we have enough beds for everyone, enough ICU beds that people that need ICU treatment can get the care they need, and enough ventilators as well for those individuals. So that's our goal. For my Health and Human Services team and Health Department staff, I just want to take a moment and publicly acknowledge and praise their efforts and thank them for their tremendous work, long hours, and dedication to our community. Right along with that, for the many Sarasota County employees who are at the EOC and at other places supporting our public health efforts. They too are working long hours and putting in tremendous efforts. The drive-through testing is a great example of that. That's combined Health Department, Parks and Rec, Sheriff's, Fire. There's a number of departments all out there pulling together to make that happen every day. And then finally, for our listeners and viewers, I urge you all to practice social distancing, stay at home as much as possible, and I ask everyone, individually and as a community, to really take this seriously, especially in the next 3 or 4 weeks as we move towards that peak hospitalization day. I can't stress enough how our collective efforts together as individuals and a community will help reduce the amount of illness in our community and keep our community safe as we move through this most dangerous period. I thank you for the opportunity to speak, and I'll be glad to answer any questions.